Hello and welcome back to part three, ladies. Nice to see you again, Ash and Mel.
Hi, nice to see you too.
Yes, hi everyone.
Okay, so today's agenda, guys, we're going to probably just listen to one more of the confession recordings. There are lots, and we could listen to more, but we don't obviously have a lot of time now because we've kind of already chewed through quite a bit of time. So we're going to listen to one more of the recordings where Rick is in that sort of state and confessing, and then we will move on to a little bit more of an explanation of how he was being housed, what the custodial conditions were, a little bit more about Dr. Wala and some of what she reported about Rick, and some of the prison guards' observations. There may be a bit of snark at some points because there's some questionable things that go on within the custodial setting, in my opinion, and probably in the opinion of the majority of my listeners as well. And then finally, we're going to get some more of the Westcott details and potentially come up with like we said, our kind of conceptualization. Of course, we're not diagnosing. So again, that same disclaimer, none of us here have clearly met Richard Allen. We've not spoken to him or anyone that knows him personally. And we're just making kind of observations and testing out some hypotheses and discussing it for kind of educational and entertainment purposes. Okay, so just to get us kind of back in, because it's been a couple of weeks since we recorded, I'm going to play a call between Rick and Kathy. So you guys will remember the times. So remember, he was arrested in October, late October. He was doing okay for the first 6 months. And then we started to hear that he had started confessing. I think the first one was, I believe, in writing around March, and then definitely full into it in April. Those were some of the calls we listened to last time. And today we're going to listen to one from May. And by around June, he had kind of come out of this space. I think part of June was still problematic. And remember, Westcott met with him in August, I believe. So a couple of months later. So this here is a call between Rick and Kathy at 5:03 a.m. on May the 10th. So this is right in the middle of this episode.
Hello?
Hello?
Hello? Are you there?
I am.
Hi, honey.
How are you?
Oh, it's good to hear your voice.
It's good to hear your voice, baby.
Oh, you doing okay, hon?
Oh, I might be now.
Okay. Well, I'm supposed to be meeting Brad here at the gas station to sign something, so I didn't know what that was about. But are they going to move you?
I don't know.
Okay.
I think maybe I'm losing my mind, but I'm not sure.
Oh, no. 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 So they allowed you to call, or have you been able to and just couldn't?
Oh, great. This is the part where it gets weird.
Yeah. I'm right here.
Oh. Are you okay?
Yeah. Yeah. What's going on, hon?
I don't know. I just think maybe I've lost my mind.
Oh. No, honey. We've all lost our minds at this point.
So Brad and so I can trust Brad and Andy then?
Yes, you can, sweetheart. Yes. Let's not talk about anything that we don't need to, but no, there are lawyers, honey. There are lawyers.
Well, I need to tell you something anyway.
Okay. Are you sure you want to talk to me over the phone?
I think I have to.
Okay.
I need you to know that I did this.
What? No. No, you didn't, dear. There's no way. There's no way, dear.
Love me.
Dear, there's no way. Okay?
I hope you still love me.
I always will go love you, honey, but no, you have not done anything. And I think you are not well. So you don't need to be saying you did something you didn't do.
Well, hon, this is the first time I've been able to talk to you, and I've been trying forever.
Were you just not allowed to call me, or?
I don't know what's going on, hon.
Okay.
I'm definitely going to lose my mind now, though.
Don't. I'm supposed to be meeting Brad here for some reason, so I don't know where he's at, but
I've been asking for personal visitation, and that's not going
yeah,
through, and
I know.
then it's taken me, feels like it's taken me forever.
You have 1 minute remaining.
It's okay. Are you there?
Yeah, I'm here. I'm just trying to be at peace with things.
Honey.
And I had a dream that I needed to let you go, and I didn't know how to let you go, and
Well, then you're dreaming stuff again. Okay? That's all it is. You don't be talking about anything on the phone negative like that. Okay?
but I have to let you know that I did it, hon.
Dear. No, you didn't. There's no way. There's no way.
Thank you for using GTL.
Okay, guys, thoughts on that conversation?
Yeah, pretty sad, like to hear that. My first initial thought was it sounds like Kathy might be aware of why Rick is talking like that. Like because, when someone like kind of does a confession, I would think that my first instinct would be like, oh, why? Like what's changed? Right. But she kind of kept saying like, no, you didn't, and kept reassuring him. So I wonder if she's aware of like his intentions. My sense is that, I can't remember kind of where we left off last time, but it seems pretty obvious to me that he is clearly very distressed and is wanting an out of this painful, suffering situation. So his intention to confess is to get out of it.
Yeah. And remember the first call where he confesses, I can't remember if we listened to that one. I know we listened to him speaking to his mum. I think we did, was like a month earlier. It was in April. So this has now been going on for a month. And so you kind of hear almost, I feel like Kathy's calmer than she was, initially, but she also sounds kind of, resigned and exhausted because this has been going on for a month now. She's been heavily criticized by people who believe he's guilty for saying things like, don't talk on the phone, don't say that, as though they're saying, she knows he's guilty and she's trying to stop him, which of course is not my interpretation whatsoever. I think it's just a really understandable, normal, response to a loved one who you believe is falsely confessing to a crime they didn't do while decompensating.
And also at this point, he has lawyers, right? At this point.
Yeah, so she mentions Brad a few times. That is one of his lead defense lawyers. Yeah,
which makes sense because, I think if they already have lawyers on board, then what she's doing is trying to keep him, I guess, it's for his safety, right? To say that, if anything, let's not do it here, and let's get the lawyers involved in that.
Yeah. And it's interesting you made one other comment around she's not asking more questions. And at no point in any of the times where he confesses that we've heard of to Kathy or to his mum, do they say, well, why do you say that? Well, did you do that? Like, I mean, they might say, why do you say that in a kind of shocked way, but they're not they're digging for more details, which just suggests, they absolutely wholeheartedly believe him. There's not even to me, there's not even a glimmer of doubt there. Mel, what do you think?
Yeah, look, I exactly like what Ash said. It was hard to listen to. You can see the sadness and the I guess, distress in a way in the voice of Richard. But what I found was, that there were so many long pauses, right? She's asked him a number of times, "How are you?" And there were such long pauses. And a number of times he's saying, "I'm losing my mind," as well. So one really can, question what's his mental state at the point at which, this
Mhm.
conversation was had. And when he's confessing, you can almost kind of hear like on one side he's saying, "I'm losing my mind," and then he's confessing. So what's the, I guess,
Mm.
credibility of that confession, so to say? And also I hear, what Kathy is saying. It sounds like, they've been through something like this before, where he might have made a similar statement, and there might have been some kind of, I guess, consequences, so to say. And then she's trying to, I guess, not caution him to not speak, but just make him aware of, how that information could be used, which rightly so. It's not about guilty or not guilty, but just making, I guess, him aware of being mindful of what he shares, because the conversation is not entirely private.
Yeah, and so I should have probably said this earlier. So at this point, he has been receiving involuntary Haldol injections. They were initiated mid-April, so we're now nearly mid-May.
Mm.
So that could explain some of the sort of cognitive slowing, as well as obviously the negative symptoms of potentially psychosis, because he is
Yeah.
quite slowed. His affect is quite flat. He doesn't really, I mean, if we go back to interview number one, I said back then, fairly verbose, chatty, talkative, and even the first call that we heard last time before all of this sort of transpired, quite animated. And now all of a sudden, there's really just nothing in that conversation. And there's a statement in there. There's two things I guess I wanted to point out. One was the statement where he says, I think something like, well, this is where it gets weird. It's kind of really strange. Like that's a really, it was a sort of an odd statement to say, almost to get a bit childlike. And then the second thing I wanted to say was Kathy says to him, "Oh, you're having the dreams again." So some of this stuff is coming up in his dreams. And I can't actually remember now. I don't think we've talked about this on camera, but one of the things that I've mentioned before is around OCD and having clients who will have dreams and then they will think maybe the dream was true. So that could also add
Yeah.
to that sort of
And
self-doubt
if I
there.
if I add to that, it's also something that comes up a lot in post-traumatic stress disorder, PTSD, like having a trauma symptom of nightmares,
Yes.
nightmares, flashbacks, re-experiencing. I mean, it is already traumatic enough for him to be in, I think, in that hold up, that isolated hold up, and then having, I'm not sure kind of what was the context that he was being put on the Haldol, and it's a medication that clearly is used for like psychotic symptoms, and it does bring a person to a much more, I guess it helps to calm when someone's agitated, but it can have that other side effect of being really, I don't have the word right now with me, so please help me with that, but yeah, like sort of just being really much more dull
I was
in
going to say
there.
dulling kind of.
Yeah, yeah.
Mm.
But still he's yeah, clearly those are lots of signs that he's actually not well, and mentally he is actually struggling. So I think that reinforces like what we're probably, all three of us are saying here, that like if there's a confession that's coming up at this point, I don't know how else to see it other than the fact that he's, like he's suffering and he's trying to find a way to get out of it.
It could also mean, like, of course, the side effects of Haldol, but it could also mean that, that he is unwell. The long pauses could be also him being responding to, maybe, I don't know, look, this could be a
Mm,
far shot, but he could be responding to voices, or could be, when we've
yeah.
seen with clients with psychotic symptoms that they are quite withdrawn in their inner worlds, because either they're responding to some kind of internal stimuli, whatever that may be. So
Mm,
it could also be, I guess, a reflection of that.
yeah,
Yeah,
that's a
for
really good
sure.
point. Yeah.
So I think this is probably a good time to sort of segue into, I guess, what the conditions were there and what other people were witnessing about Rick during this period. So we've gone from Rick's background pre all of this to how he presented when he was interviewed and interrogated. We've now heard in his own words and kind of observed how he's speaking and how he has presented at 2 points at least in his incarceration. We had one kind of baseline before the decompensation, and we've listened to a few during the decompensation. And now we're going to hear the opinion, I suppose, of staff within the correctional facility. So I'm going to read through just a few notes here, and then I'll stop and pause and get some ideas and thoughts from you guys. So in terms of the custodial conditions, so he was being held at a place called Westville Correctional Facility from November 2022 up until December 2023. His housing was isolated, and they termed this safekeeper. It was essentially solitary confinement for around 13 months. He had camera surveillance 24/7. The lights were always on. He could dim them, but they were not controlled. Actually, they could be dimmed, but they were not able to be controlled by himself. Bear in mind, Westville Correctional Facility, where he was held, is a facility for convicted offenders, and he was obviously pre-trial detainee, so already that's a deviation from what usually happens, and this was justified by the prosecution as for his own safety, being a high-profile inmate, and also in light of his significant mental health issues in the past, they said that this was the safest spot. His defense team argued that he needed to be moved out of there, but it took a long time for him to get out of there. So the contact that he was receiving, he had out-of-cell visits only for recreation, showers, medical, mental health, but his sessions with his psychologists were held in a small 3 by 3 foot cage with grating, and he was shackled at times during his transport. So his cell itself, I had the dimensions somewhere, and I can't find them now off the top of my head, but it's quite small. It's a tiny cell, certainly nothing to speak of at all. And I think it had one small window that looked out, perhaps, but yeah, pretty horrific conditions. Yeah, so I mean, any thoughts on that, I guess, before I go on to the observations?
I guess I have questions, and maybe I don't know much, but one may think that why was he subjected to such harsh conditions? Like, what was their concern to put him in this kind of solitary confinement, with these, yeah, with camera surveillance, lights, and all? Because we know how that impacts somebody's senses, right? What kind of the sensory implications of not having, experience darkness during nighttime and not having any orientation to day or night. Yeah.
Yeah, it's particularly severe conditions. I believe the UN mandate in relation to solitary confinement. Again, I should have had all of this stuff pulled up, guys, but it's I can't remember the time frame that is within that mandate, but obviously it is not 13 months. I think it's a matter of days, not months. Again, they justify it as for his safety, but having worked in correctional facilities here in Australia, that's not how things are done here. There would be people who are in protective custody, and there would be times sometimes where we would isolate an inmate where we felt there was a high risk of harm to themselves, on a suicide watch, but that was always just a matter of days, and we would really work hard to try and ensure that we could get them back out to be around others. So we would find a suitable companion who was a more trustworthy kind of person that we felt they'd be safe to sort of be housed with. And there's a whole protection area within our jail system in most jails where offenders like or pre-trial detainees like Rick could be put to have sort of bigger monitoring, like a lower inmate to staff ratio, so that they're a lot safer. So this is particularly harsh. Generally solitary confinement and segregation is more for offenders or inmates who have misbehaved and are a danger to others. And it's not week on week on week.
Yeah, if I can just add to that, because it just reminds me, like, even, like this particular topic itself about solitary confinement and, the word that comes to me is like restrictive practices. We can think about restrictive practices in various forms. There is like what Amy is saying, the prevention of harm to others. And there is also the prevention of harm to self. Now, I guess the prevention of harm to self part is the one that it sounds like that was the justification here, but there is such limitation in thinking about keeping someone safe through trying to restrict them and control them. Because what happens is that, it just kind of reinforces the idea that the person is going to do something to hurt themselves or whatnot. And so then the solution would just keep increasing as like more and more restriction. and it becomes like a vicious cycle. So, I think it's a whole, I guess, area in itself, because I used to work in disability, and we talk about restrictive practices and trying to remove that. It's a whole like systemic thing that, has to come from a different lens and different perspective. You think about trauma-informed practice as well. How much can you do to keep someone safe by giving them so little, I guess, even sense of like autonomy and control? It's very different from like, say if he had restrictions that, like, I don't know, access to shops or whatever, but not in the sense that then the environment is not even safe to begin with. I think there's irony in that.
Yeah, for sure. So just a few more things about, I guess, his housing in Westville. So initially, when he was brought into custody prior to being in Westville, at the first facility, he was on suicide watch from November to December 2022. And I think that's quite understandable, given he had been arrested out of the blue for this horrendous crime and has a mental health history. That was then removed because he seemed to be faring okay in custody, which I think is no mean feat given what was going on. But then it was reinstated in April after the escalation. So he was monitored by companions initially, so suicide companions. I believe these are other inmates who watch over him, but it's not like what I was saying before, where they're actually hanging out with him and doing nice stuff with him and like kind of like living in a pod with him. This is them sitting outside the door watching and ensuring that he's not harming himself. This was subsequently changed to officers. He was being taunted by other inmates, including, I believe, some of the suicide companions, being called baby killer, being told to go kill himself. He had restricted property, so he did have a tablet, but at some stage he broke it. And now they will say, well, he broke it himself. But nonetheless, that was his way of communicating with his wife and his family. There's talk of infestations, ants and rodents, limited communication with family. So, he wasn't seeing Kathy. Not reported, actually. We've seen images of him going to court with, shackles on him, as though literally he's Hannibal Lecter. And again, there's been no indication that he was ever any significant harm to others. I mean, he lost a significant amount of weight during his incarceration, particularly during this period. And he's not a big guy to begin with. I'm actually going to pull up a picture. I've shown you, I believe, Ash, I've shown you this picture before, but I'll show you too, Malika, because you've seen now what he looked like at baseline because you guys watched the first interview. Okay, so here's just a collection of photos from just a Google search. That's not Richard Allen, that's someone else. So sorry, guys, I'm struggling to get the pictures on the screen. So this is him at arrest here on the left-hand side. So that's kind of looks very similar to the man we saw in the interrogation. This is, I think, still fairly early on, but you can see the shackles and all the people around him, and he's wearing that vest there. And then this is one of the more disturbing pictures when you see him here. So
that's really different,
yeah, right.
That's a lot.
Yeah. And then, I mean, I guess if we want to go further in terms of what he's looking like a bit later down the track. So this is him now. So you can see, obviously, a fair amount of aging, understandably, given everything that's happened over the last few years. So he's gone from this to this. It's just intense, isn't it?
Yeah.
Anyway.
Can I just make a comment? Like, I kind of see this sense of like, what's the word? Like, when someone's in a fight or flight response, like or like freeze even. I'm thinking from that frame of like, safety, not safety. Yeah, I think if anything, regardless of his baseline, he's clearly, in a state where when someone's had that level of like chronic stress and trauma, they kind of decompensate and plus other mental health difficulties that that we've heard about.
Yeah. So again, I guess the reason we pulled those photos up partly is to show that sort of deterioration, but also partly to show the conditions, the shackling, and then also to show the fact that, we've got a small framed man who has lost a significant amount of weight. So I don't believe that, he would have posed a particularly significant risk to anyone else, particularly as he has no history of any aggression or violence. So I'm going to just go through a summary of the course of his mental health in custody. This is a summary of a whole lot of statements from prison guards and some of the publicly available information sort of summarised because they really, in trial, interviewed a lot of staff members. So really trying to condense all that down so that we don't spend hours going through each and every part. So I'm just going to take you through the timeline. So we've got November, December. So it was early custody. He reported anxiety, fears, being treated as guilty, selfless concern for wife. He denied suicidality, but was feeling stressed, complained about the kimono he had to wear. So because he was a risk of harm to himself, they'd have to put him in the sort of kimono. It's sort of like a hospital gown, you know, so it's not, you know, it's not really covering his body particularly well. And it would feel
vulnerable.
Yeah, vulnerable. Yes, exactly. So he complained about that. He complained about inmate taunting. And, you know, obviously there was a lack of orientation to the rules. He's never been incarcerated before. And as far as I'm aware, has, you know, no history of anyone in his family that we know of that has sort of gone through this. So it was obviously a massive shock to his system. And he continued to express his innocence and, you know, just the shock of everything that he was going through. And then we've got the next year rolls around. So January to March, he had some complaints around the commissary. I think the commissary is I forget what we call it here. It's a commissary. It's you know, that when they can actually use their money to buy extra things for themselves. So like I remember back when I worked in the jails here, you know, they'd buy their favorite foods, or it could be buying, you know, new razors and things like that. It's kind of like your supermarket, I suppose. Yeah, he complained about lack of letters, physical discomfort, missing clothing, heartburn. He'd adjusted somewhat and his focus had shifted to hopes for family contact and visits. But as we know, by April of 2023 is when we saw the marked decompensation. So he receives the discovery documents, which, are you guys aware of what discovery documents are in a legal case?
Yeah.
Just say a bit just to make sure I'm thinking the right thing.
Mel, would you like to explain to Ash?
Yeah, so discovery documents are essentially all the evidence that has been gathered either through the police or you know, the defense or the prosecution, and they share the documents amongst each other. So you're meant to share everything. That's why it's called discovery.
I see. Yes. Okay. No, thanks. Yeah.
And it's important to say you're meant to share everything, but in this case, that doesn't seem to always have occurred. But, you know, obviously one of the main things in this discovery file would have been the crime scene photos. And, you know, we've talked a little bit about the crime. Those photos would be horrific. There was a point, unfortunately, where these were leaked to the internet. I haven't seen them in full. I've seen, you know, a kind of blurred out part of a photo, but I haven't seen the full photos. I've seen recreations of them in drawings, but I mean, I can only imagine, like, you're seeing a 13 and a 14-year-old girl in a terrible condition. I mean, this is brutal. It's a sadistic crime, and the way that they're posed. So, I mean, that would be sickening, of course, for anybody to look at. He's going to, receive the case that they have apparently against him. But I think the crime scene photos and, you know, and the autopsy reports and things like that, I can only imagine what that's like to read, particularly if you're not the offender. So he receives these discovery documents, and that coincides, I think, roughly with the onset of the confessions and the bizarre behaviours. So we talked about this last time. He does tell the prison psychologist, Dr. Wala, that he killed Abby and Libby. He said that he did it alone, that there was a sexual intent, and that he cut their necks and covered their bodies. She says the narrative is given coherently and without psychosis. Of course, that narrative, as we discussed last time, is not recorded on video or audio. It is just recorded in her notes. So hard to really know. Yeah, what are your thoughts, guys, in terms of if somebody is in a sort of psychotic episode, in that sort of decompensation that we've talked about, do you feel like they would have periods of lucidity where they could give a detailed confession of a crime like the one we talked about last time?
I think it depends. I mean, you know, it depends on the severity of the psychosis, how far in they've been unwell, what medication they're on. I think that there are all these factors to consider. When we look at diagnosis as a clinician, we often try our best to establish what is the person's baseline. Baseline meaning how they're like when they're well, when they're safe, you know, before anything has happened, and how they are presenting at a time where you're assessing them. Of course, it's a little bit hard to identify the baseline if someone's already come to you when they're unwell, but you know, like, you try to establish that, right? You know, and we often ask questions to get a sense around, you know, how they're like when they're talking about maybe, you know, something that is easy to talk about, like his interest and more simple topics, which usually, you know, like when there's no trigger activation, and then, you know, how they're like when they talk about something that is activating, more or less to get a sense around, you know, what's different. So I think if, you know, and from the sounds of it, like he, you know, it's quite clear that he has decompensated, and so he's definitely not at baseline. So he is presenting, and probably then, you know, we can make a very, I guess it's a very clear hypothesis that is fitting, that whatever that he said is not whether it's true or not. It's just that, like, I mean, if he's not well enough to be, you know, to be clear that that's something that comes from having like a sound state of mind, then it's really hard to tell, like, you know, if that's true or not.
I think as well what people will sometimes confuse or get confused by, if you don't have, I guess, direct experience with psychosis, either, you know, your own personal experience or experience through people you know, or obviously professionally, they'll think that the person is sort of ranting and raving all the time, and that's what a psychotic person looks like. And look, of course, there can be people who are going through an episode where it's fairly consistent, but just because somebody sounds, I guess, quote unquote normal, doesn't necessarily mean that they're not psychotic. And in fact, most of us, I'm sure, have worked with people who have some psychotic symptoms where on the surface, they, you know, if you didn't know them and again, you didn't have any baseline, I know I've believed people before. They've been telling me something and initially I'm like, oh gosh, that's terrible. And then you hear more and more and you go, wait a minute, there's some paranoia here, and, you know, this isn't adding up. So I think this misconception here around psychosis being, you know, the person just screaming out and yelling out and saying the TV's talking to them and things like that, that's a bit of a misconception. It's a sort of stereotyped view.
Yeah, no, I agree. But like we know, like psychosis can present in very different ways, and you can have a psychotic episode and have moments where you are quite lucid. However, I guess that's like Ash said, that's not the baseline. So then how do it would be really challenging to say, when somebody is, say, for example, making a confession, whether, you know, they are fully in their sound mind when they're doing it, right? Especially if you have evidence that they are not. So
Yeah.
I don't think it's that black and white, any kind of psychotic disorders. Yeah.
And now I know none of the three of us are experts in the treatment of psychosis. You know, it's not an area, I don't think, of expertise of any of us, but what would you guys do if you were trying to, I mean, obviously, again, it's why we're not forensic psychologists either, but what would you do to try and ascertain whether somebody is feigning and faking psychosis versus it being true psychosis?
It's a tricky one. I'm trying to kind of recall now, like the times when I've worked with it. Like when I did my forensic stint, definitely had a lot of experience with that. But it's a while now. In private practice, I've only had trickles of it. Yeah. So what comes to mind is, you know, if you're in, I guess, like a inpatient or prison facility, you can observe them 24/7. So you get some data points around, you know, how they communicate when they're in the assessment or the interview, and how they are interacting with other inmates or with their family or with the prison guards, or like sort of getting more what we call like not corroborative information. That's interviewing the other people, which is also one option, but, you know, just observing how they're like in comparison to the time where you meet them. So I would kind of look at how consistent their behavior is. So if he seems to present quite similarly across the board, across the day, and he's, you know, saying things in a very kind of like, there's a coherence and there's a flow and there's a logic, then okay, you know, that's a possibility that there's a level of sanity to be able to, I guess, you know, coherently express that. If there is more variation, you know, like at times being really quiet, at times being really talkative, if his mood or the internal state or the external behavior is fluctuating, I would also look at how reactive someone is. So like, you know, whether are they reacting to things that seem to be internal, which means, you know, like with psychosis, and if there's hallucinations, delusions, like, you know, people would, this is where the more classic, you know, talking to themselves, mumbling to themselves, like might happen, because they're responding to an internal stimulus, right? As opposed to if say they're having a conversation with someone and someone's provoking them and they're responding, that's more like being activated by something that's happening in the environment. So I will be looking like at all these factors. And I think that, like this is kind of just a little bit of like looking in the mind of, when a psychologist is assessing someone. And if we're doing a thorough job, we will be considering many factors. We won't just look at a very superficial behavior, because behavior doesn't tell us everything. Behavior is one indication, but the behavior needs to be seen in the context of what's going on.
I mean, something that I would think that I would do, I mean, obviously there are some formal tests of malingering and validity scales, which Westcott did do. Obviously this is after the event, but still she did that, and there was no indication of malingering for Rick. But even you could informally kind of test that by asking about really absurd symptoms, like let's say, I'm speaking to Ash and she's presenting as psychotic, and mostly we're not trying to sort of fool and trip people up, but you could ask some questions like, I'm trying to think of a really absurd question. A lot of people who are psychotic see ducks flying around their heads. Like, has that happened to you? Like kind of, and again, there are instruments to do this. So it's not like you'd have to come up with random things like I just did, which was not a very good example. But yeah, and notably, Dr. Weiler did not do any standardized assessments. So when she's saying he's feigning, this is just her own opinion. And yet, at the very same time, this man is being given involuntary Haldol injections. So, we can't kind of have it both ways, can we? Either he's feigning, in which case, why are you giving him such a heavy-duty medication? Or he is actually psychotic and you kind of need to take him a bit more seriously. So for me, that was a bit of a shock, because when I worked in the forensic system here, we had access to all of the standardized measures that you'd want to have, and you could get access to them. So, if she really seriously is spending so much time with him, she's getting a confession from him, then you would expect that there should have been some standardized follow-up in terms of how he was presenting symptomatically and in terms of malingering.
Yeah, and I also think that the other way of doing it is, look, if he's been put on treatment with the Haldol, right, that means that he's also getting monitored regularly. And from what Ash was describing, doing a mental state examination every time he gets reviewed would be your data points, plus all the observations the prison guards would have. That combined would show how he is responding to the Haldol, how active his psychotic symptoms are. Is it working or is it not working? I think those would be indicators, right, to say how his mental state is deteriorating, being maintained, or improving.
Yeah.
And so I think, and consistency across settings, consistency kind of across his behavior over time. And they had access to that because, of course, you had 24/7 recording of him. And Westcott did have a look at that. And I believe Weiler looked at that too. Interesting to note here that he didn't just make confessions about Abby and Libby. He confessed to starting a world war. He confessed to having sexually assaulted his sister as a child and other children and his own daughter, which, of course, on the stand, they all denied. There was no history of any known sexual deviance. He confessed to being an alcoholic and a sex addict, which, again, people have taken and run with. But Westcott had access to his medical files over decades. Now, I'm not saying he couldn't have hidden that from his providers in all these years, but realistically, I think it would be hard to hide that from your wife, from your employer, from every medical professional you've ever seen. He's been an inpatient before in 2019. Like, nobody else has ever raised that, but he said that in one, or maybe multiple, I don't know, but at least once to Dr. Weiler. So, I guess what we're hearing here is a whole load of confessions to things that he clearly didn't do. He said he murdered his grandchildren. He doesn't have any grandchildren, or he didn't at the time. So, if we think about consistency there, we can see he's just throwing out like these random things that he did. Interestingly as well, and I don't know about the research in this. I may go and have a little bit of a look, but I guess going back to like, can somebody in psychosis say things that are true and make sense? Yes, things like, what's your name? Who are you married to? Where did you get married? Like, factual stuff, yes. But things like this really kind of constructed narrative about a story of how he committed a crime is less likely. And the narrative, at least that's how I would imagine it to be. And this narrative that he gave, which we talked about last part, really would just seem to be constructed around the discovery information that he already had, or the stuff they kind of gave to him as part of the interviewing process. You know, there was one detail we mentioned, the van, which was still not really 100% consistent with what probably could have happened. So the story itself as well as bizarre. You know, I decided that I wanted to sexually assault them, but then I got spooked by a van. So instead of sexually assaulting them or using the gun I had to kill them, I traipsed them across another, you know, a creek that's fairly deep, and then I murdered them with a box cutter and I staged their bodies. You know, it doesn't make sense. That's not logical. And then we can say, well, if it's not logical, was he having a psychotic episode then? But again, as we've talked about, there is no other history after that of psychosis. You know, we haven't seen that for the last 5 years. So again, it's where you start to, you pull it apart and you go, this doesn't, I don't think it rings true or makes sense.
Yeah, and when it doesn't make sense, then our next question would be, so then why, right? Why is he saying that? You know, what's the context that he's saying it? And I think that that's, you know, when we think about like scientific reasoning, we're often making hypotheses, and hypotheses are like making guesses, but we test the guess, right? We don't only look at one possible avenue, you know? So if, for instance, if we're looking at, okay, he's faking it, right? Let's see if there's evidence of that. But we need to also check for evidence that he's not faking it. For instance, if we're talking about the, you know, is he feigning or not, as one question in mind, we have to look from both sides and gather the data and actually do a comparison. That's an objective way of assessing and scientific reasoning. If a person, regardless of, you know, opinion, is only looking at one direction of testing, you know, like for instance, even I know that's not the focus here, but if the testing is around like, is he guilty or not, did he commit a crime or not, regardless, any form of scientific testing has to look at both sides. Like if he's guilty, you know, what's the evidence? If he's not, what's the evidence? And I think that that's kind of, yeah, pretty surprising and shocking that, you know, even in the psychological assessment, I'm not, again, I haven't looked at the specific details, but it doesn't feel like it's as objective and detailed as it could be.
No, not at all. And I'm so glad you brought that up too, Ash, because in this community, I know for myself personally, I have been accused of flip-flopping, because earlier on, I wasn't sure if this man was guilty or not. You know, I was kind of on the fence, and the psychological profile didn't match, but that's exactly, you know, what I've done. I think some people listening to us right now might think I'm very biased, you know, anyone who watches my channel, because I'm saying, well, he's innocent. And, you know, am I leaning that way? Well, I've spent months looking at the other side as well. And I did flip-flop a lot initially, even though the psychological profile was more consistent with him being innocent. I've looked at all the evidence and really tried to consider it from multiple angles. But yeah, it just doesn't feel like that was done. Yes. And this is not the only witness, and you know, who has a qualification in a scientific field that doesn't really adhere to that scientific process that you just mentioned of testing both sides and the hypothesis testing that, you know, really should be part of a routine assessment. So just to note some other psychotics like symptoms that were described, and I think again this will be another window into this kind of discussion around feigning or not. We had things like eating his own feces, smearing feces over himself, laying in feces. We had drinking toilet water, eating the discovery paperwork, some of it. We had nudity, masturbation. So I think there's a story of him dancing naked, masturbating, singing, you know, a country music song. We had bizarre prayers. We had dreamlike grandiosity, statements like wiping out the world, nuclear war, and severe sleep deprivation. So day upon day without sleep. So when you start to hear some of these type of symptoms, in addition to, you know, the confessions and, you know, the affect changes and things that we've already talked about, does that give you any more of an impression around feigning?
Yeah, I think that it kind of makes it even harder to think about someone feigning. And I think we're making assumption around feigning as a very conscious kind of, you know, trying to elicit some sort of, fake psychosis that he's very well and he's kind of, you know, pretending to be unwell. Clearly, someone who is pretending wouldn't go to that extent and that level of severity. Yeah, it's concerning. Like, it's very concerning behavior.
Yeah, right. I mean, that's the thing. That's a very extreme form, when he could, if he really wanted to feign, you know, would use more stereotypical symptoms. I remember that there was a case, it's quite an old case, the Hillside Strangler. He is a well-known serial killer from America, Kenneth Bianchi, and he was very crafty. And actually, when they arrested him, they found psychology books. So he had really read up on psychosis to try and understand how best to feign it. So, but this was a criminal mastermind. This is a serial killer. This is a very different kettle of fish. Rick Allen, isn't reading. I'm guessing. They didn't find the DSM and, case study books, because you wouldn't even see that in the DSM, eating feces. It would only be something that you would know about if you had some fairly intensive experience with psychosis. Yeah, I mean, it's not commonplace. Even being in a psychiatric hospital, you probably wouldn't routinely be seeing that. So it's extreme. And to me, again, I think if you're going to try and feign symptoms, that wouldn't be the one that would come to mind. But I think they gave this example. One of the prison guards said, yeah, but he did it. And then he said, I'm never going to do that again. That was gross. And it's like, well, yeah, because he still has sensory experiences. He might do it and think, and be completely disorganized, but it doesn't mean he's not going to still have a reaction to it. That's sort of like saying, well, he ate inedible things and he vomited, therefore he was faking.
If we look at the frame of, like, even when someone's having active psychotic episodes, like the fact that they are in a controlled setting, and he's on medication, and what's the medication called, the one that Helidor, the one that kind of like it's not really so much a medication as opposed to like something to calm the nervous system. You will clearly see moments where the person will start to just in little glimpses, like start to feel a bit more calm and safe, and they might still have a little bit of insight around what's happened before and have a reaction to that, right? But that doesn't kind of, again, like, that's not any information to say that it's not enough to say that he's feigning it just because.
I mean, it's the equivalent of saying something like, that person's not depressed because I saw them laughing. Like how ludicrous would that be? Because, most of our clients, when we see them in the waiting room, they smile when they come in. Yeah. Well, they don't need therapy then. They're not depressed. Like, it's actually, it's ridiculous to me. We've got to look at the overall picture. Just another point as well that I've heard said by other people is, well, if he wasn't malingering when Westcott did her testing, that means he's an honest person, so he must have been honest about the confessions. And that really got my back up. I did not like that. Does anyone else want to speak to it, though?
Yeah, I do think that the, I guess, way of thinking like that would be pretty black and white. And we know that, black and white thinking often misses the mark. What I mean by black and white is that, if you're saying someone who is honest will always be honest, and therefore whatever they say is from honesty, that is not a very human way of, like, humans are more complex than that. Or if someone is a bad person, like, again, what is a bad person? If we think that a bad person does everything, and everything that they do is mean and evil and manipulative, that's also, a very rigid way of looking at things. So I wouldn't agree with that. If he's an honest person, then everything he says now is honest. Again, I would think about context. Like, context is so important, right? Like, I think that, again, we often look at behavior and just kind of, when I say we, I mean, when people kind of look at behavior on the surface level and make assumptions about it, it's not untrue. You can make a hypothesis about the behavior, but then we have to look into why. Why is the person saying this? What's the context? What are they responding to? Does this fit the initial hypothesis that we're testing, or does it not? I mean, if we just look at everything in a very simplistic behavioral way, then we're really missing the point. I think that's my opinion.
Look, you can't keep giving him Haldol. Haldol, from what I know, and correct me if I'm wrong, from my previous experience, is that it's a pretty heavy duty drug to treat psychosis, and it's given when other antipsychotics haven't worked, and then you choose that line of treatment. So one can only imagine. So if he was feigning it or faking it or whatever, why then would you continue giving that if you had evidence to say that he's faking it, right? So why would you continue giving it to him on an involuntary basis, that too?
Yeah, I just wanted to mention, because I just had a quick Google. Because Helidol, which is haloperidol, which I remember when I was in forensic, it was used quite a lot. There's a difference between it being used as a regular medication, which is actually I don't even know if it's used regularly. Like we have many other antipsychotics that are used regularly, but Helidol, from what I remember, is used more like a sedative. That's the word I was looking for. Sedatives are used when someone's having an episode or they're being unsafe to themselves or others. So it's actually more like an acute thing that we use that, right? It's not to treat. Yeah. So just wanted to say that.
Yeah, but were there any indications for them to say that, that was actually happening, where they needed to do that on an active basis? If they are saying he's faking it, then why was the need to, drug him like that? Right? So that's the question. Yeah.
This is the inconsistency, isn't it? And I mean, I think from my understanding, he was self-harming in ways like, running into walls and things like that, to the point where he was black and blue. I wouldn't put it past the possibility of concussion and, as some sort of TBI, it was pretty significant. So, I think that clearly, again, is that something somebody does if they're trying to exaggerate or feign? Like, that's a significant level of harm. I just also want to make a point on the malingering. So the malingering scale in the Millen or in the MMPI, I believe, is similar too. It's not an honesty scale in general. It's not like, are you an honest person? It's not based, on that trait of honesty. It's based on exaggeration and denial or social desirability. So it's like, is this person exaggerating their symptoms, or is this person denying their symptoms and minimizing them to look good? Do you know what I mean? So it's more like I am faking psychosis, or I'm underplaying, my dysfunction because I want to get a job. So it's not a measure of honesty. So I think it's a massive reach to then say, well, that means he's an honest person and that means his confessions were honest. But also, because if he's an honest person and his confessions were honest, he didn't confess for 5 years. So that's not very honest, is it? It worries me though, some of these lines of reasoning in terms of evidence in this case and even commentary on this case, like, they do worry me, because that doesn't really make logical sense, does it?
Yes.
I get fired up about stuff like that, guys. That.
I think this is where, also I do remember, Amy, that, part of the reason why we're having this panel is because this is where our skill set as psychologists, right, like our training, our intensive training, and the line of reasoning and thinking that we come from can be really useful for people to be aware of. So that kind of, if people are willing, right, to kind of consider that, that there are perspectives to kind of, or even I guess tools and skills to kind of utilize to actually have a deeper or more objective way of assessing something, as opposed to just blasé opinions and black and white thinking, either or kind of thing.
Yeah, I mean, an assessment and a conceptualization of someone is layered. It's, it's layer upon layer of information and trying to connect those dots, rather than you scored this on a test, therefore you are this. But I do, and I mean, this is not to say that all forensic health professionals do this, but I think in this case, sometimes that seems to be what's coming through. And of course, this is just a publicly available information. We're not obviously seeing all of their notes and documents, but it just feels as though it's quite a reductionistic approach. And that worries me, because this is not a simplistic case at all. There's no black and white in this case. So I think that Rick should have had more complex analysis, so that he got a fairer process, which is a whole issue with this whole flawed case against him.
Yeah.
And even a more balanced kind of diagnostic, even if, say, for example, you do come up with, or whether he's faking it or whatnot, maybe a more balanced would be, I guess, hypothesis as to why, or what could be the other considerations. It sounded like it sounds pretty one-sided.
Yeah, there just doesn't seem to be a consideration of as many layers of whether it's diagnoses or causal factors, or everything just seems to be very much like a checklist of tick box. Like, the first thing we come to, let's tick that. Yep, that's what it is. So during that marked period of decompensation, the April to May and into June period, that's we've seen a lot of unusual behaviors in terms of risk. We've got sort of verbal ambivalence to suicide, part of me wants to die, fears of his heart stopping, desire to see his family. I believe he says things like that Abby and Libby had to die so I could live, or something like that. There's, again, some fairly bizarre statements. Once he starts to improve, again, in around sort of the June period, He's a bit more coherent because the medication has sort of helped to some extent, according to their records. But he's still showing continued guilt. We've still got shame. We've got the religiosity. I want to go to heaven, but no hallucinations. But this is where, again, staff started to suggest that he was doing some instrumental behaviors, like, a hunger strike to leverage for TV or visits. So they were, again, kind of saying that's manipulative, I suppose. He managed to get a few in-person visits with his wife, but they were super rare. And he continued to have verbal suicidal ambivalence, but no plans or attempts. In July to August, there was some noted physical changes, so bulging eyes, but that later resolved. And there was ongoing depression, paranoia, preoccupations, but was more organised at times. And then, so that's August 23. He goes to trial in October 24. And during that time, there was still, as far as I'm concerned, there's still some behaviours that seem a little bit sort of left of centre. So somebody reported that as a jury, before the jury came in on one of the days in trial, he was reading his Bible at the bench. And when they came in, he put the Bible down for a period, and stood for the jury. And then he went back to reading the Bible. And I think I mentioned this to you guys last time. He was reading quite slowly. The fact that he's reading, obviously the optics of that are not particularly good. Like, on the one hand, yes, he's reading the Bible. He's not reading, some sci-fi novel, but still, as a jury, a layperson may sort of say, well, he's not focused on what's going on around him. So a little bit of an unusual behavior again. So still, I don't think back to baseline, but definitely significantly improved. So I'm just reviewing and to see if there's anything that I've missed in terms of what was said about him. I think that's pretty much it. There's a lot more information about, what each of the guards had said and the specifics, but I think you've got a broad enough picture at the moment. Maybe before we finish up today, because we'll do the diagnostic considerations and final thoughts in the next part, I'm going to turn to you two and see, what do you think about Dr. Waller's behaviour that was certainly brought to light as part of the pre-trial proceedings and during trial, and that is that she was actively searching and engaging in the online true crime community about this case during the time that she was treating Rick. She walked to the trails and went to the Monon High Bridge, which is the scene of the crime, and she also let Rick know that she saw people online speaking about the case and that he had support from people online. Yeah, what are your thoughts on that?
Just to make sure that I'm remembering correctly, so Dr. Waller is the assessor or treating psychologist?
She's the prison psychologist.
So that's different from the person who assessed him later, right?
Yeah, so the defence expert, okay, Westcott, does the sort of, the short-term assessment. Dr. Waller saw him throughout, right, and she's the one who said he was potentially feigning and had that sort of detailed confession.
Gotcha.
Had in her notes, yeah.
Yeah, that's also a big part of like our training, right? Ethics. And if we're someone's ongoing therapist, it's really important to have those clear boundaries. It's one thing for, all of us here don't have any professional relationship with Rick, so what we're talking about here is clearly, it's all opinion and it's from a distance, right? So there's no issue engaging. But when you have a personal or professional relationship with someone, especially in that professional relationship, I think it's concerning that I don't know if that happened out of curiosity or or what the rationale was to find out more information, but even so, that's concerning. Like just kind of crossing the boundaries in those ways, engaging in ways that's actually risky and it can be harmful to, in this case, her client Rick.
Why do you think it is so harmful? Why do you think that that's so problematic?
I think it's problematic because I don't know what the motive is. Like, I'm just putting myself in her shoes. Like, my job is to treat and provide the psychological intervention, whatever is presenting in front of me, I would think, as a psychologist, rather than, I guess, go and, put an investigative hat on. I don't see the purpose of that. As Ash said, curiosity is one thing, but don't know if I would go and do that. I find that for me it creates, and also kind of a bias, right? Because what am I hoping to achieve through finding this information? As you said, she was engaging the online community. What was the purpose of that? Like, I don't know. So
Particularly because the online community, first of all, is not going to be corroborated information about a case for a start. It's opinions-based, particularly in a case like this that's been unsolved for many, many years. You've got some strong voices in this community who, are not always going to be talking from fact. We didn't have facts. I mean, there was a gag order. There was so much that was sealed for such a long time. So you're not really getting an accurate level of information. The only reason I would see that you're engaging in the online community would be because, you're interested in trying to solve the case yourself or figure it out, and understand more about it. I mean, I understand curiosity. I think if she'd, looked at a few articles about the case, or read maybe like or watched a documentary on the case, I'd maybe even understand that to an extent. I think it could still bias her, but that would sort of mean that's more passive. But I think the thing that compounds this is she wasn't just passively looking at this information. She was engaging with people in that community. And, some of those people in the community are incredibly biased one way or another. So, I think that's super concerning because we really don't want to be biased about people that we're there to treat.
Yeah, and if you think about it, like even just from a very basic, psychological ethics perspective, like, the first thing is like do no harm, right? I just think that's concerning because like if we take the forensic aspect out of it, like if I were to go out into the public and talk about my clients directly, identifying them and talking about them to other people and making comments about them, like who is going to say that's okay? Like that is actually very there is a power difference and it's really utilizing that in a concerning way.
And it's the equivalent of literally going and spying on your clients, setting up a secret camera, or going and speaking to the people who bully your client so that you can understand their perspective. I mean, we don't do that. That's, that's
unless it's collaboratively, that's one thing, right? If for instance, even like getting an adult client's family to come in, like we get their consent, we make sure we establish everything clearly. I don't just go behind their backs and call, their friends or their family.
Go and sleuth. I mean, of course we all have curiosity. I think working particularly in a forensic setting, I think, of course you'd be curious if you have an inmate come in and they're accused of a crime, you might have some level of, interest, but I think it's gone beyond just a casual interest to really acting as though you're recreating and solving the crime when you're going to the trails, you're engaging in the forums. It wasn't the only questionable thing she did. She also did use her access to the prison systems to look up another known person of interest in the case as well. So that's also obviously come into question. Which again, I mean, having worked in the prison system, again, there's curiosity. I would have loved to look up offenders that, were high profile, to be honest, not to solve a case for my particular client, but I never do it. You're not allowed to do it. You're not meant to do it. You're not, just like we're not supposed to read each other's files just because we're curious to know, oh, I wonder who that interesting person that Ash sees is. I want to find out more about her. Like we're not allowed to do that.
Yeah, it just seems like, she's obviously not operating in the best interest of her client, right? That kind of, going on these online chats or on the trails, it's not informing her treatment. And hence I said that what's the motive of her doing that? Then you can question that, right? Like what are the gains, personal gains that one can almost ask her? Yeah.
And particularly when then it transpires that the only person that has a detailed confession from Rick is her, with a fact that apparently only the killer would know. Like I said, I don't even agree with that. But even if we go with that, well, I mean, this starts to become problematic. I mean, what did she hear and read online? Is there any suggestibility? Maybe not even on purpose. But, there's always these funny things that I come across on social media, and I definitely can relate to them in my dating days, where in the digital era where you would look up the person you're going on a date with or that you've just started dating and you would like find out all about their life and then you'd accidentally mention something you shouldn't have known because you stalked them, like it's that sort of thing. It's like me going, oh, Ash, how's your auntie Lisa? And you're like, I never told you I had an auntie Lisa. Oh, yeah, oops. I mean, that's the thing. You can inadvertently do that when you're sleuthing on someone and, understanding more about them than they've told you. It makes that confession again questionable. I'm not even suggesting that she, went and got information and fed it directly to her. I know some people would suggest that. I don't necessarily, the thing is you can't rule out even accidentally transmitting information. And again, what is her intention? Is her intention to be the person that solved the case? Like, was she literally going, what happened? Tell me more about it. And she says she wasn't, but she is the only person that has got this detailed confession. Not Kathy, not Janice, who's Rick's mum, not his dad, but Walla, who he didn't have the best rapport with, definitely initially wasn't super keen to be speaking to her. It wasn't like, he'd really bonded with her. She was the only person he could speak to and leave his cell to go and have a chat to when he was suffering. So, it was better than nothing. But, why would he trust her when he's on the phone to Kathy, and saying, I did it, I need to tell you, but he's not giving her the details.
Yeah, which then kind of like begets the question also whether, what was transpiring between the two of them. And I think about, like, I'm just kind of reflecting on just, like generally for myself and just like our work as a therapist, right? I think there's a reason why we have so much, we have to be so mindful about, like, our opinions, what decisions we make, in regards to our clients, because, like, again, that there's so much power in, like, being in that position of knowing things, but also in the position where, like, that there is a lot that you can help the person as well. And if they're not, or Rick was not feeling safe to share any information or talk to her, there could be so many factors there. But I think then even more so the fact that if she then went to look for information, outside of their very limited, I guess, therapeutic alliance, I guess then that the kind of just is another factor that makes it also more concerning, because is she then the right person as the psychologist that is meant to support his mental health and psychological well-being?
So one last point of criticism about Walla, and then we'll finish up for today. And I'm a little bit more on the fence about this one. So basically, the defense attorneys asked her, did she have the written notes that she took down during these confession sessions she had with Rick? And she said no, she entered them into, the prison system, the computer system where they would keep the case notes. Now, a lot of people have said, that's destroying evidence and, that's unethical. And I suppose, look, I've never been in a situation where I'm writing down somebody's confession, because that's not really been my job, even when I worked in the jail. I mean, obviously common practice for us within the clinic is we type straight into computers. But if you didn't, I would usually write, some sort of drafts of notes, not drafts. I'd usually write some notes as I was speaking to someone and then go and transcribe them and put them into our digital system, and I would shred the written notes. And I'm guessing that's similar to what you guys would do.
Yeah.
What do you think you would do if somebody shared something that was a confession as part of your treatment with them?
If I'm not writing it straight into, the computer, I would make a note of it, right? Of, what they're saying, if not verbatim, at least what they're saying, and make a note of, the time. Generally my practice is, when I'm with a client, if anything we are discussing or sharing, if something stands out, I do make a note of it. I write it down, even just to jog my memory for when I'm going to type up the notes in the system. That's my practice.
But I suppose in terms of, I guess, the complaint people have is, she said she jotted everything down as she was speaking to him. She then transcribed that into a more detailed case note, like we would do, and she shredded the written notes. I mean, to me, generally speaking, that would be fairly normal practice as psychologists. I suppose if it's a confession in this case, it's a much more sensitive thing. It's not a commonplace event. Maybe I guess this is a warning for psychologists, because I think, maybe it is better to just have the written notes. The problem is, though, the written notes are often really scrappy. I mean, if you read my written notes in sessions, you would not be able to understand them. But I suppose if you're taking a detailed confession, and this is where the lines get blurred. She wasn't meant to be getting a confession.
Yeah, I think that's exactly it. Like, if this is like general client updating about their life, their week, mental health things, whatever that we're working on in sessions, like, sure, we summarize in our recorded notes and shred the drafts. But this is where we often make the distinction when it comes to something legal, because the point is that there is actually an impact, right? Like, she's working with a man who whose life is, at stake here. And so that information has to be given different weight from other information that's being transpired in a session. And I guess like what I mean, again, I'm not in the context, but I'm just thinking if I put myself in that situation, it would be, letting my client know that, look, my role here is to support you, to, ensure your mental well-being. So is this something that you want me to, because I have to write in my notes if you tell me, but, if this is not our focus right now, is this okay that you share this with your lawyer instead of me, like actually having that discussion. And also like, I don't think that that's going to be just because the client's talking about it doesn't mean we just ask more. And it's not it's self-serving, right? Like, if I were to ask more questions just because I want to know, that's not in the client's interest. Right?
No. Now, I think, in our role, what we'd more commonly deal with would be maybe potential threat. And in those cases, if there's a risk of threat, yes, we would generally ask more questions to ensure that our client or anyone else who could be affected by a client is safe. But there was a case where somebody was a risk to, I think the client said Taratoff, I think it's called, where I believe it's that the client was the person that was risk to someone else and the therapist didn't do anything about it. And I think subsequently somebody got hurt or murdered, but that's very different if it's impending risk. But in this situation where the police have already, incarcerated this person, he's on trial, they've got their evidence and stuff. Yeah, my sense would be shut it down. You're not supposed to be taking the confession.
The important thing is that, coming back to what I was saying earlier, that being in a professional role like that comes with a level of power difference with the people that we work with. So that same power can be used to help and support, and do what's effective, what's right, but can also be self-serving. And that's why there's this, so I am a strong believer in the therapist having to constantly be self-reflective and aware, because the tendencies are there, we talked about how as human nature, the curiosity will be there. But if that feeds and festers into behaviors that are outside of one's role, it brings about a lot of risks that may not be actually, I guess, could do more harm than good.
I really agree with what Ash just said. It talks about informed consent, right? That's such a good point you've raised. Because at every step of the way, when we're talking to our clients in any new journey, whether we're doing any kind of work, we talk about, okay, this is what I'm going to do, this is what will happen. And did she do that? And that takes me back to my question all along, that what is her motive of doing what she did it's out of scope of the work she was assigned to do, essentially, as a prison psychologist, is to provide him with supports and psychological treatment. So she was, always working outside that scope, right? And not knowing her work. I don't want to sound, but I really question her motives for doing that. What was it?
And that's the thing, having worked in that field, maybe, look, I didn't have any maybe major, high profile cases like this, but it didn't even really occur to me to, you might in your mind sometimes I'd have the odd person on remand and you think, they would say I didn't do it and you think, oh, I wonder, but that wasn't our role. Our role was to ensure that the person was safe, was well, was looked after, was, and potentially was, if, for the people who were actually sentenced and convicted, to help them rehabilitate. It wasn't to be an investigator. So I mean, it's hard to reconcile, right?
And this is also just writing off what Mel is saying, and Amy, kind of a little bit of that as well. This is why, especially when it comes to very complex and sensitive situations like that, it's a good thing to have a different psychologist for the therapeutic support and the assessor, because being able to utilize two different ways of thinking and approach, it's very different, right? If we're assessing, you can kind of take a step back and look at it in an objective way, and you are in a position to ask the questions. And I guess, again, even for an assessing psychologist, it's not about confession, right? It's about the person's mental health, but it's not about, you don't have to be in the position where you're thinking about, I guess, the person's well-being to an extent. Whereas if you're in a therapist role, it's almost like it doesn't really matter as much what the diagnosis is. I say that like with the caveat that we need to know to inform treatment, but the focus is much more about the person's well-being. So I think that's why the therapeutic alliance is so important. If she's not, I guess if things are not kind of working out in that way, then I don't know if she's actually kind of playing the role. It may not be that it's her limits of her skills. I'm not sure, but I think that's where if we kind of step back and look at the purpose, is it serving that purpose and the role that she's playing? And clearly, like we're all saying, that it's not.
And her role wasn't the assessor, it
exactly. Yeah.
But this is where, I guess then people start to question, who was in her ear, and this is where it then can get into that conspiratorial territory, which in this case it's hard not to at times with certain things. But yeah, I mean, because that wasn't her role. It was not her role to be trying to get information out of him and to get a confession. Her role was purely to monitor an at-risk inmate and ensure his safety and his welfare. So there's just no reason for her to blur those lines. I see, though, Ash, what you're saying. I mean, and we do this all the time in our own work, when a client will say, oh, can you write a letter for me for court? And I'm always very careful to say I can write a treating psychologist letter. That's very different to a forensic assessment, because I'm biased. I'm your treating psychologist.
Yes.
I'm not.
And we're meant to be biased in that role, right? Like that. Yeah.
We're meant to show, to, I mean, obviously not to collude with the client, but to be on their side. We're not meant to be objectively looking at them as, which is essentially what an assessment process in a forensic.
And I want to distinguish the difference, right, between like being biased about someone's level, whether they're guilty or not, versus being biased as opposed to I have their best interest at heart and I'm supporting them in that place, right? Which is so different. Like I have clients actually who I'm now thinking like, who are in various form of court cases, and I'm their treating psychologist from day one. Whatever that I do and support them is actually really about their mental well-being. Like it's always coming back to that. Yeah.
Well, essentially, I mean, the type of therapy that you guys know that I love and, really feel has informed my practice is schema therapy. And we talk about therapy being limited reparenting. And obviously it doesn't mean we're being a parent, it's limited, but it really is. It's forming that sort of repairing attachment bond with your client and helping them through that. And so, I mean, you would not ask a parent to, basically to say that whether their child is guilty or not guilty. I mean, well, people do that. I have heard of cases where that's happened, but I mean, it's not exactly the same, but it is still relevant because our role is to form a secure, helpful attachment with our client in order to help their healing. And so how can you do that if you're constantly looking through this lens of are they guilty or not?
Sure. Yeah. And what Mel said as well about informed consent, like, definitely limited reparenting is one thing. And then there's also the person-centered practice, right? So it's about a collaborative practice. Okay, what is the person wanting to get out of this, or how can I help and support them with the skills that I have that's also in line with what they want. We don't work against our clients, right? We don't work towards a goal that's our goal and not theirs. Again, in the realm of the mental well-being.
And I think, this was grilled at some of the hearings, by the defense around informed consent. I don't have the particulars. I mean, there's pages and pages of transcript here. I think she indicated that she had informed him, what would happen if he confessed and, what he could and couldn't say and what was and wasn't confidential. I think it was a little, again, I don't want to say it's a fact because I can't remember. I haven't read the transcripts in full, but I believe she said that, they had blanket forms and things that were signed. But that's not really good enough in a scenario like this because I think you need to repeatedly inform a client like this rather than say, well, they signed that consent form back, in November when they were well,
I guess in times like that, when somebody is saying something of that significance, you do have to reiterate in the moment as well, right? It's not about a signed form a few months or, so ago. Yeah. Even I just wanted to make a point that, even if, say, they're an assessor or a treating psychologist, everybody has a role to play with Rick. And, none of their roles were to judge whether he's guilty or not, right?
No.
Or to lead the narrative in a certain way, which is what, throughout this session, that's what I was picking up on, whether it be the assessing psychologist or the treating psychologist. It felt like it one-sided on both occasions. So I wonder if they steered away from what their role was or what they were hired to do.
Yeah, I think this case, from having looked at various parts of the evidence, like I said, not just in the psychology aspect, and I know this happens in the legal system. I've heard of this before, and when I've worked, in other types of cases that involve legal aspects, there is, you feel like there's a lot of bias. And I remember when I worked in workers' compensation for a while, there would be doctors that, as in, I hated the job working as the insurer because it's horrible, because you're often trying to, minimize costs, decline claims and things like that. And, there would be particular people that would be more client focused and particular people that would be more employer focused. And so you would know that. You'd be like, okay, well, Dr. Sally is, almost always says that the person is guilty or the person is lying. And Dr. Lucas almost always says that the employer is in the wrong, and that we call them hired guns. I just think that really takes away from the credibility when we have biases, right? And I mean, I see this just overall playing out in this case, even in the online community, because I know I am strongly advocating for Richard Allen, but, that's come at the cost of months and months of deep diving into things and having moments where I thought, oh, maybe I'm wrong, and I've sort of have flip-flopped. But there are, unfortunately, people that get so gung-ho in their approach that they just impermeable to anything that suggests otherwise, which means you can't then integrate it. Because for me, every time I caught something that actually made me think maybe he is guilty, it helped me integrate more information and be even more confident, and to now be able to have set up, a whole.
And I think that's good practice, right? Like, what you're describing there, Amy, is that you're considering new information that comes your way. You're not just dismissing that, by saying, oh, because this was not where I stood by, I'm not going to even consider it, or just think that that's crap. Like, again, then that's not, I guess, that's not having that sort of more, what's the word? Yeah, like just having a broader perspective and actually having more clarity about your stance. So I think, that is exactly like something that is, I think, a really important approach to have, a skill to have. Yeah, and it doesn't mean like it's not black and white. But like you said, like when you take those information and then you sort of start to question and then you do your research, then it gives you a chance to actually have a choice point, right? Do I then change my mind now because the information is different, or does it actually show me that, oh, there is a way to understand this, and therefore reaffirms what you initially thought. Yeah.
So it's flexibility, it's critical thinking, and I've had this catchphrase that I've been saying for the last few days, particularly. So, I mean, the people who believe Rick Allen's guilty are impermeable to any information. Not everybody, but there's a group of them. But the people who believe Rick is innocent, some of them are also impermeable. And I've sort of been saying not everything is a conspiracy, because if we start to say every single thing is a conspiracy, it takes away the credibility from the things that possibly are conspiratorial. I don't know, if we make some speculative claims, it's like we can't prove that. And then when you start throwing mud everywhere, then none of it sticks, essentially. So I tend to take a more cautious approach. I will definitely call out things that I feel seem like they could be suspect or conspiratorial, or related to potentially wrongdoings of law enforcement. But I think we've got to be really cautious on both sides, not to always see everything through the lens that we prefer. That isn't actually advocacy, and that's not actually helping anyone. What that's doing is it's making you just seem incredibly biased and therefore have no credibility, right?
Yeah.
Okay, well, we'll get back to that, because I think there's a few more points on that we'll bring up in our final kind of wrap up. And I think we'll end there for today, if that's okay.
Sure.
Sounds good.
Okay, thank you guys. I know you've spent lots of hours doing this with me. I hope you're still enjoying it.
Yeah, it's really good to be thinking about these things. It really kind of helps me to kind of even just just kind of exercise those parts of my mind and verbalize the things that we often do but don't verbalize it in this way.
And all the stuff we actually knew but we just never talk about, right?